Castration, the clinical facts and therapy of cryptorchidism and testicular tumours. For castration, use general anesthesia. For the pre-med, have fentanyl, midazolam, and ketamine. For induction, have propofol. And for maintenance, have isoflurane. For the post-op, give meloxicam and antibiotics. For preparing the surgical site, for the prescrotal, have clip the prescrotal and scrotum area, have it clean and put Vaseline on the scrotum. Put the dog on the table in dorsal recumbency and disinfect the area with alcohol. Make sure the scrotum is clean, clipped, and the dog goes to the table, then you disinfect. For procedure, prescrotal is done in young healthy dogs. Scrotal is done in older dogs with testicular problems. In prescrotal, push the testes cranial towards the midline, so towards the penis, and then fix it one hand and have an incision over the testes, not the scrotum. And then push the testes out through the incision. For the closed method, the tunica vaginalis is intact. Peel off the fascia until only the tunica vaginalis is left. Then introduce ligation through the tunica between the plexus pampiformis and the DD. Ligate only plexus first, then transligate everything together, the cremaster and the plexus, and the ductus deferens. 2 ligations are better, monofilament and absorbable. Place a hemostat 1 to 2 centimeters towards his testes and cut off the testes. Check the stump for bleeding and put the stump in the inguinal canal. Repeat with the other testes. Close the wound in 2 to 3 layers. In the open method, the tunica is open and the plexus and the ductus deferens are ligated separately. The scrotal approach is done in older dogs with testicular or scrotal problems. A bay leaf incision is done on the skin, following the base of the scrotum. Then detach the scrotum to the fascia spermatica and the tunica vaginalis communis. In the closed method, don't open the tunica. In the open method, open the tunica. Check the stumps and put them in the inguinal canal, and then close in 2 to 3 layers. In tomcats, it's scrotal. Make 1 incision over the testes. It's an open method. Ligate the ductus deferens and the plexus together. Then leave the scrotum open and spray. For the post-operation, protect the surgical site and have pain relief. Cryptorchidism is a failure of one or both testicles to descend. They normally descend around 8 to 12 weeks after birth. The closure of the inguinal ring happens at 6 months. An isolated cryptorchidism means there's no other phenotypical abnormalities. You should check the testes between 12 weeks and 6 months. It's the most common congenital genital malformation. The prevalence is around 1 to 10%. It is more likely to happen in small breeds than in large breeds, such as Chihuahuas, miniature Schnauzers, Poodles, Sheepdogs, Yorkshire Terriers. And there is more than one gene. It's a sex-limited autosomal recessive trait. Unilateral occurs in around 80% of cases and bilateral in 20% of cases, and it's inguinal in around over 70% of cases. Abdominal is quite rare. We usually see a smaller retained testicle. The animal is considered fertile, and so is the testes, but the testicle is predisposed to neoplasia due to the higher temperature. For the treatment, do a bilateral castration. Remove from the breeding. Conservative method is not effective. For testicular tumours, they're the second most common tumours in male dogs. They occur in older intact males, around 11 years old, and they are interstitial cell tumours, so the Leydig cell tumours. In boxers and German shepherds, they get a seminoma. It's quite common. Cryptorchids get Sertoli cell tumours and seminomas. It's very common. It's usually unilateral in around 55% of cases and bilateral in 45% of cases. In cats, cryptorchidism does not seem to predispose testicular cancer. The signs are E-production can cause feminization and symmetrical alopecia. They can get gynecomastia and secondary mastitis and attraction to other males. It usually resolves 1 to 6 months after castration. For the treatment, do a closed castration and bilateral is better. In gonadostomal tissue, The benign tumours are Leydig and interstitial cell tumours, and the malignant tumours in gonadostomal tissue are Sertoli tumours, and these can cause estrogen production. In germ cells, the benign tumours are teratomas, and the malignant tumours are seminomas and malignant teratomas.